Okay. Disorders of immune system, either hypersensitivity, transplant, or autoimmune disease, immune resistance amyloidosis. Let's take hypersensitivity reactions. We know all the types, but in type 1, it will be rapid. It will be rapid, as we see here. When the patient is so sensitive to something named by allergen, example pollen. His mucous lining will be contact with the pollen. So the dendritic cell, which is antigen-presenting cell, will be interact with naive T cell and stimulate B cell to release an immunoglobulin E that contact with mast cell by Frick part. Okay, and this lead to stimulate mast cell to release the mediators, which are two types: cytokinase and vasoactive amine lipid mediators. Histamine, as we know, this is histamine cell have antigen and Frick receptor Frick part related, which connect with immunoglobulin E to send signals for degranulation. Histamine has cytokinase, which is light phase reaction like leukocyte infiltration, epithelial damage, bronchospasm, signal for oxidation of phospholipase A2. Okay, also have membrane phospholipids, as we see here, that lead to immediate response, which is vasodilation, vascular relocation mode, muscle spasm. Okay, or have granule like histamine, proteases, chemotactic factors. Okay, so there are, in these mediators that is related to these terms, we have three groups: radioactive amines. Okay, within the histamine cell, mast cells like histamine. Okay, chemotactic factors, neutral proteases as the proteoglycans. You synthesized lipid, another group. Newly synthesized lipid mediators like prostaglandins, which cause bronchospasm, or leukotrienes, which cause increased vascular permeability and chemotactic. Cytokinase, another group. Histamine of the cell, which is also named like mast cells if I do wrong in my pronunciation. Okay. Cytokinase, the activation of mast cells results in synthesis and secretion of several cytokines that are important for the late phase reaction. We know that, like TNF kinase, like this. There are two types for clinical manifestation of heart disease type 1: systemic, like anaphylactic shock in PV norm and BC. Okay, local reaction in skin allergy, food allergy, allergic rhinitis, allergic conjunctivitis, and bronchial asthma. Cytokinase airways associated are all the hypersensitivity type 1 may be associated with inflammation, so especially in cytokinase, which is late phase reaction. Okay, so this may be needed to anti-inflammatory drugs such as corticosteroids. As we see here, there is xenophil, while this is small one is neutrophil or histiocyte. Xenophil is always pink in color, and this thing is edema, fluid, water. Okay, so this is so clear. This is bronchial asthma type 1. This is so clear, bronchial asthma, characterized by eosinophilic infiltrate and mucous membrane, vascular action and air congestion. Type 2 antibody vs antigen. fixate on cell surface or their components. This occurs because in transfusion reaction because the antibody coded the antigen. This occurs Graves' disease, myasthenia gravis, pernicious anemia, acute rheumatic fever. Also, this also occur in celiac disease, as we know, because the body is secrete antibody against self antigen. Okay, so type 2 is anyways reaction between antibody and antigen, while in type 1 is anyways reaction between immunoglobulin E against protein against allergen from outside. Also this from outside, but it must come on from within the body, self antibody, self antigen, or self antibody from any source with a self antigen, like antigen of the self antigen or another sort of antigen. But anyway, it reaction to antibody and antigen, and the antibody code to the antigen. While type 1, the antibody is interact with the antigen and cause lysis and release of mediators. Not in type 2, cause coated and lysis. We are in type 2, there will be coated opsonization, while in type 1 no opsonization, just lysis and release of mediators. Type 3 is formation of immune complex. It may be either systemic or local formation of immune complex and complement activation. If it will be in vasculitis or artery, in glomerulonephritis, glomerular based membrane, as we see here. Plasma cell and B cell will release antibody and interacts with the antigen, and the endothelium is just example cause the immune complex, so the neutrophil will interact with this reaction to lead to cause platelet aggregation, and this develop disease now by vasculitis, immune vasculitis. Okay, as we see here, fibrinoid necrosis, laboratory infiltration and inflammation. This is type 3 is anyways immune complex and complement activation, either local or systemic. Local as in vasculitis and glomerulonephritis, and maybe systemic to all the body, as vasculitis maybe include all the blood vessels. Hypersensitivity, cell-mediated, there will be no antibody because the T lymphocyte will be sensitive. Divided into two types. Sorry, I am in hospital now. Delayed type or direct cell cytotoxic. Delayed type CD4, as in TB infection. Direct cell cytotoxic, as in virus or cancer. Sorry. Example, rheumatoid arthritis, multiple sclerosis. DM type 1. Also, this may be related to celiac disease, inflammatory bowel disease, Shreya's disease. Okay. Antigen resistant cell with a CD4. Okay, or CD4 release cytokinase cause injury, tissue injury, while as in TB, and CD8 direct interaction. Okay, and lead to cell killing and tissue injury. In both types, after there will be anyways some cytokines like interferon gamma, which stimulate fibroblast proliferation and effect on the macrophage to develop epithelial cell and giant cell that collect to form structure known by granuloma. Okay. Now some examples. One of the following is an antigenetic cell, is dendritic cell. 20 years, it has asthma, immunoglobulin E, type 1. Hypersensitivity to all except rheumatoid arthritis. What rheumatoid arthritis? We know. Rheumatoid arthritis, it is autoimmune disease. Autoimmune disease. T cell, self-antigen. Following is example of type 4 hypersensitivity reaction. DM type 1. Psoriasis type 4. Type 3 reaction, deposition of immune complex type 3. Type 3 mediated by immune complex. Example of type 3 silly. Granules of mast cell contain all except prostaglandin, and prostaglandin is not within mast cells. Excuse me. All these following are true about type 2 except there will be no delayed type. Type 4 hypersensitivity mediated by type 4 always related to lymphocytes. Maybe the most common is CLF. The granules of mast cells contain all these following except we say that all these following are examples of type 4 except acute rheumatic fever. What there will be? It is acute rheumatic fever, cough with bodies formed by antibody coded the antigen. Type 2 rheumatic fever. Also, the self-minor chronic inflammation due to type 1 hypersensitivity are eosinophils, as we say that in bronchial asthma. It is pinkish in color. Histamine causes all of the following except anticoagulation. Never cause this. What causes anticoagulation? We say that in vasculitis. Platelet aggregation. Okay. Sequential phases in individual of systemic immune complex cause platelet aggregation. Immune complex cause platelet aggregation. Thanks for watching.